Hey everybody, this is Sean Gray, and I'm talking about Maria, who was for our week six case study. Maria is a 23-year-old who was referred by her PCP because for the past 2 months she has been seen in the ER 4 times for the acute complaint of she feels like she's having a heart attack. She's presented with chest pain, palpitation, shortness of breath, sweating, trembling, and fear that she's going to die. Every time she has had a negative workup, including normal vital signs, EKG, troponin, and no signs of cardiac disease. Her symptoms have happened at home, while she's been driving, has awoken her in sleep, and most recently at work, prompting her coworkers to call an ambulance and again, continued normal physical exams. So, my diagnosis after reviewing the case study for Maria was panic disorder. She meets DSM-5 criteria with unexpected panic attacks, abrupt surge of intense fear and discomfort that reaches its peak within several minutes. And she also has the somatic symptoms to go along with this. The chest pain, shortness of breath, trembling, pain radiating to her arm. And these have been followed by at least 1 month. So, in the case study, it said 2 months of persistent worry and maladaptive changes. It's interrupted her sleep. She's been avoiding exercise, caffeine, multiple work absences due to her symptoms. Um, I did consider health, illness, anxiety, um, given her symptoms, but she does meet the DSM-5 criteria more, especially given her somatic symptoms and almost classic panic attack symptoms. She does, however, ruminate on, having a underlying cardiac illness that people have failed to find, particularly the providers in the ER. I also considered generalized anxiety disorder, but she does not meet DSM-5 criteria. She hasn't had persistent worry for at least 6 months. Her symptoms have been only going on for 2 months with this. Treatment for her, SSRIs have been shown to be the most effective for panic disorder. I specifically chose Zoloft to use because studies have shown that it is one of the most effective with great long-term outcomes. And for her, I chose to use PRN Atarax up to 3 times a day. Yes, it can be sedating, but has relatively fast onset and can help with both during a panic attack if she had one, while the Zoloft is building up to take efficacy and overall her anxiety symptoms. I did consider benzos, especially the shorter acting ones like Ativan, but giving her age, I prefer to avoid using benzos given their abuse potential. I did review with her the black box warning for Zoloft or SSRI specifically with increased suicidal thoughts, ideations, and actual suicide in young adults and adolescents. I also reviewed GI upset, headache, sweating, sexual dysfunction, rarely induction of mania, hyponatremia, syndrome of inappropriate antidiuretic hormone, and seizures as well. She has no significant past medical history, so I do believe that Zoloft would be a safe choice for her. For hydroxyzine, as an antihistamine, I reviewed dry mouth, sedation, convulsion at higher doses, but we're going to keep relative basic doses for Maria. Um, and QT prolongation. But given her multiple negative recent cardiac workups, normal EKG. She has no history of QT prolongation and lower risk. And addition to pharmacological management, I'd also recommend CBT and incorporating exposure therapy as well, which can both be very effective for panic disorder. Um, In addition to that, specifically, she does have panic attacks while there's a loss building up in her system. Mindfulness or the five sense grounding technique, I believe, could be very beneficial for her, as well as sleep hygiene. She has woken up several times with some panic symptoms. So sleep hygiene, including going to bed at a regular time, waking up at the same time, decreasing screen time, all to benefit her. And that is my treatment plan for Maria. Thanks.